Hi, good evening, everyone. I know that participants are just logging in, but we have a very packed schedule, so I really want to start on time. So I'm just going to go ahead and start the introductions, and we're going to get right into it while persons are rolling in, okay? So happy World Breastfeeding Week. We have actually come to the end of the week. This is the last day. It's recognized August 1 to 7. And I just want to welcome you on behalf of the Healthy Caribbean Coalition and Healthy Caribbean Youth. I am Simika Alexander Williamson, and I am a Healthy Caribbean Youth member, and I'm also a lactation consultant and registered nutritionist and the director of Cradle of Life Limited, and I will be your moderator for this evening. This year's theme is prioritize breastfeeding and create sustainable support systems. And this reminds us that breastfeeding isn't just about individual choices. It requires real, consistent support from families, communities, health professionals, workplaces, and policymakers. Now, across CARICOM, we've seen some progress. A few countries are approaching the global target of 50% exclusive breastfeeding by the end of this year. However, there are many countries that still face significant gaps. Too many parents, especially working mothers and young moms, don't have the support they need to start and continue breastfeeding. In the midst of that, we also acknowledge the recent World Health Assembly resolution, which calls for a stronger regulation of the digital marketing of breast milk substitutes and greater accountability in how companies interact with health professionals. It's now up to us to ensure that these global commitments lead to real protection for our families on the ground. We're hopeful that the upcoming fourth high-level meeting in September will prioritize breastfeeding as part of long-term child health and development strategies. We need to see those discussions translate into concrete, sustainable action across the region. Now, let us not just use this week to celebrate breastfeeding, but to concretize what it is that is so important, getting things enveloped into the system and to push for the systems to make it possible every day for every family. Well, we have a very wonderful panel here, and I'm just going to go ahead and introduce. Okay, before I get to that point, let's just point out that the webinar seeks to fulfill these objectives. So we want to promote breastfeeding and breast milk as the primary nutrition for newborns. We also want to address the impact of digital marketing on breastfeeding and child development. And lastly, we want to identify breastfeeding best practices across the region and solutions to potential implementation barriers. Now, our panelists this evening are going to help us to do just that. And they are in no particular order, Dr. Audrey Morris, and she is the Decentralized Regional Advisor for Food and Nutrition, PAHO, the Pan American Health Organization. Dr. Alison Bernard, who is the co-founder and executive director of the Breastfeeding and Child Nutrition Foundation of Barbados, which has co-branded with us. Ms. Renee Brown, who is a NICU registered nurse and IBCLC of the Cayman Islands Breastfeeding Support Group. And Ms. Robin Daly, who is a nutrition technical advisor with the Ministry of Health and Wellness, Belize. So as you can see, we have got so much representation from the different islands because it's the Caribbean and we want to have the voices everywhere. We want to see what is happening all across the region so that we can share best practices with you this evening. So we'll kick right off with our Mentimeter. So I'm going to hand over to Norja.
Yes, thank you, Samika. Good evening, everyone. Thank you for joining us. I will now share my screen and ask you all to join our poll so we can just get a feel of what the audience thinks about breastfeeding. Let's see. All right, I cannot see you all, so please let me know if you can see my screen. Someone unmute and say yes.
Yes, we can see.
Yes.
Perfect. So please use the QR code or the number code at the top of the screen to join, and I'll give you all about a minute to do so. And you can thumbs up on the poll when you've joined, so I can get a sense of how many of y'all are on. All right, I'm gonna go on to our first poll of the event. Do you think breast milk should be marketed to increase breastfeeding? Most definitely, yes, but I don't see it happening. Maybe, no. What do you all think? Okay, most definitely is winning right now. I think there's at least 40 people on, so let's see if we can get those numbers up. Okay, there's 23 people on, waiting for a few more answers. Okay. I'm curious to know for the persons who said yes, but I don't see it happening, maybe, and know if they could just put their thoughts in the chat. And we're going to hear from our panelists shortly on their thoughts on this as well. Okay. All right. In the best interest of time, I'm going to stop the poll right here and pass it back over to Samika.
Thank you, Narja. So, for those of you who just joined us, the recent question was, do you think breast milk should be marketed to increase breastfeeding? If it is that you didn't get to join us on the Mentimeter, feel free to get the chat going where you can have that discussion. We want this to be very interactive. As much as we want to control the mics, feel free to post as you will in the chat. Now, we're going to go right ahead to our panelists and we're going to start the conversation off. And from our panelists, we want to know, within the scope of your involvement in maternal fetal health, children and newborn development, and postpartum care, identify one major barrier to breastfeeding. That's one. And two, how does your specialty lens inform your approach to addressing these issues? So right away, I just want you to identify each person. Let me tell you the order that we're gonna go in. We're gonna get Dr. Bernard first. Just tell me one major barrier to breastfeeding within your scope.
Hi, good evening, everyone. I hope you can hear me. Thank you so much for inviting me onto this panel. This is a wonderful panel before me, and I'm really looking forward to sharing and chatting with everyone. So I've been asked to identify one major barrier, but like the rest of the region, the rest of the world, Barbados is affected by many of the barriers from, inadequate maternity leave to inadequate support for breastfeeding mothers, practical support for breastfeeding mothers. But I would say in Barbados, in my work as director of the Breastfeeding and Child Nutrition Foundation, I'm working on the ground with these mothers every day. A major pain point for these mothers is inadequate legal protections after they return to work from maternity leave in terms of being able to continue breastfeeding when they go back into the workplace. That's a major one. Some of the data that came out back in 2016 was that 40% of mothers said that the reason why they stopped breastfeeding or they mixed fed, so breast and formula, was because they had to go back out to work. And then recently, the 2024-2025, the average breastfeeding duration in Barbados is 2.27 months. So that is just around the time that mothers are going back out to work. So I would say for us, although we are exposed to a lot of the barriers, that is a major pain point for us here in Barbados and our mothers here in Barbados.
And just for everyone's clarity, Dr. Bernard, how long do mothers usually get maternity leave for?
So in Barbados, up until June 1st, it was 3 months, so 12 weeks. But as of June 1st, we've had an extension to maternity leave. So it's now 14 weeks, which is more in keeping with I. So it's more in keeping with the International Labour Organization, but still, you know, hopefully we'll head towards 18 weeks and more as time moves on.
Okay, great. Thanks for sharing. And we'll just go right ahead to Renee. Can you share one major barrier that you experience in your area?
Thank you, everyone, for having me. Such a great part of, such an excellent panel to be a part of. Like Dr. Bernard, we also face similar challenges with the length of maternity leave and the time that it will take for mothers to go back to work. We find that oftentimes they have a short leave and they have to cease breastfeeding in order to resume work. But not only that, support is also a big issue. A lot of our families are expats. We have a lot of families that are by themselves, like a mom and just a dad, or a small family, so to speak. So they don't have that external support to kind of cushion that the challenges that they'll experience with breastfeeding. And I do find that to be a big issue here on Ireland. We do have the breastfeeding support group that tries to come in and help in that case, but I must say it does go a far way when you have someone within your space to kind of encourage you and guide you when you're having your challenges within the home.
Thank you so much, Renee. So far you can see that even though this year's theme is prioritize breastfeeding and create sustainable support systems, we already see that there is not necessarily strong support systems. And with that, I'm actually gonna go to Robin. I want to sum up with Dr. Mars because she is at the regional level, so she can give us a little bit of a perspective of what's happening. But Robin, go ahead and let me know some of your barriers.
Okay, good evening to everybody, and thank you for having me. In Belize, we have similar challenges like the others mentioned about the legal protection for women in terms of the maternity leave. It is not sufficient. And another big barrier for us is also workplace support. We have been working extensively on this for us in Belize, but the support that the mother would need when she's going back to work. So an area where she can be able to do breastfeeding or even have the support to get required time off to support that. And there is no legislation in place for this. So many times because of this, women just tend to forgo breastfeeding and then they would just resort to formula, things like that. So we have started a campaign to support workplace. We're calling it workplace wellness, but we include breastfeeding spaces in that. And that has been helping us to address this challenge.
Okay, thank you so much, Robin. And Dr. Morris, just from your perspective, you know, regionally, what do you think are some of the major or one of the major barriers that we face with relation to breastfeeding?
Right, I agree. And good evening, everyone, and thank you for having me on your panel. I agree with the previous speakers. The whole issue of maternity protection really has to be looked at. The laws that exist with regards to maternity leave for mothers to be able to take a little time during the day to breastfeed their babies, for them to be able to store their milk, and so that they can have it when they go home to feed their babies. Those are issues that our maternity protection laws should be in place to address. I'd also want to mention, and I'd ask if you can put up that slide that I sent, formula milk marketing, and it is a major problem. For the industry, this is they have a huge amount of funds and they are marketing the formula. They're using multiple channels to persuade women that they need this formula. And so, despite the efforts of the health sector, the advocates for breastfeeding, if you're up against a $55 billion industry, really, how much inroads can you make? If you look on the slide, you'll see the different, no, the same one. You see the tactics that they use. They're on television, they're using digital marketing, influencers, free samples. They're in the health sector, so they form baby clubs. Sometimes you don't even know that it is a formula company behind this. And that slide, that part of the slide I have at the bottom, when the baby is born, the family is welcoming a new baby, but what is the formula company see? There's a new customer, someone else that they can really offer their products to. So that's a major problem. If I can just take a minute to highlight the next slide, and I noticed somebody put in the chat the need for education of mothers. And I'll just mention that in our region, we are really promoting the 10 steps to successful breastfeeding, which are critical for success in breastfeeding. And in that, there is the whole aspect of education for mothers about breastfeeding. Thanks.
Thank you so much, Dr. Morris. I just want to highlight, so some of the barriers that we have been looking at are, the little bit of maternity leave that we're getting, support from our family members, especially in the Cayman Islands, because a lot of persons are expats. Robin spoke about, the workplace support lacking, and Dr. Morris spoke about the marketing of formula. Now, one of the things that I want you to just talk about, so Dr. Morris did highlight that we have the 10 steps to support breastfeeding that are supposed to be promoted in the hospitals, including education, support, mother-to-mother support. But Dr. Bernard, just let me know, is there anything that you're currently doing in Barbados or within your organization to, combat this sort of barrier, anything within your specialty lens? Let me just hear from you. I know Robin mentioned something, and I also want to hear from Renee as well. Go ahead, Dr. Bernard.
So yes, certainly within my specialty lens, which is as a pediatrician, public health advocate, and then of course as the director of BCNF, our focus is child health, maternal wellness, etc. And in my work in the BCNF, we focus on a lot of community-based programs and providing one-on-one consultations to mothers, breastfeeding support classes, breastfeeding support groups, whether virtual or in person. We have a WhatsApp chat of a lot of chatty, over 200 really chatty moms, a lot of peer-to-peer support in these groups. So we do a lot of promoting of providing education and information to these mothers to help combat these issues. Oh, you're muted.
Thank you, Dr. Bernard. And Renee, you can go ahead. Is there anything that's being done to combat the barriers that you have? I know you spoke about a lot of expats, so there's not a lot of family support.
Well, yes, we do have a few things in place. Our breastfeeding setting is sort of formal and informal. The families here do get support from the public and private hospitals, but we also have, through Passion, a lot of small groups that have been formed, mom groups that do bring in professionals to provide education on different topics for these families. And also, again, we have the Cayman Islands Breastfeeding Support Group, which is really a grassroots support on island itself. And it's far-reaching as they do hospital visits for these families after they've delivered. We provide educational resources, one-on-one education for vulnerable populations, such as our teen moms, which is a passion project of mine. We also make breast pumps available to these families at a nominal fee. And again, we're hosting our second annual breastfeeding conference. And all of this is just to increase awareness, increase support, and we complement the service that is provided by the hospitals on island. We have one statutory body, and then we have 2 private facilities. And they all have their own professionals that they brought in to serve their clientele. So lactation support is provided there, and then the support group itself complements the services that are provided by these facilities.
Thank you so much, Renee. So as we see, there's a lot of chats are going on in the chats. I just want you guys to pitch in, is there anything that's being done within your country, any sorts of best practices that are happening? What are some of the barriers that you're facing? And if there's nothing being done, for example, no sort of campaign or anything, do you think there's anything that could be done? Is there anything that we've spoken about now that you think is applicable within your local country? So let's just have the chat going while we talk here online. Now, the next question that we're going to bring to the fore is directed to you, Robin. Cultural norms and societal expectations of mothers can significantly impact breastfeeding outcomes for both mom, parents, and the baby, right? And have long-lasting effects beyond the postpartum or newborn period. So we're talking about these cultural norms and societal expectations. How can we provide or improve access to appropriate and correct health information and counseling to mitigate this? We're talking about access now.
For us here in Belize, we have a couple strategies that we use for education. So I mentioned we do our wellness support campaigns, and we do have a strong network that we do education with. So our network involves our community health workers, it involves nutritionists, it involves nurses, rural health nurses, public health nurses, and district health educators and nutritionists. And also we are scaling up with our partners and then stakeholders. So we would have training sessions, we would have campaigns, and the campaigns are done across the country and they vary in terms of different targeted groups. So we would target workplace officers, then we would target people at the clinics, then we would also target people within community settings. We also work along with the private sector as well. We are strengthening that as well, working with them. So we believe that once we have strong networks to support education, that helps to improve information access that people would need to make decisions, because sometimes people might not know what options they have in terms of breastfeeding, and sometimes they fall in line with, or they might believe sometimes what the manufacturers or the formula companies are saying. So having them be exposed to more information is helpful. And recently we started to also work along with having lactation support. That was a barrier for us and that was a challenge. So we're strengthening that as well. So if we have more people on the ground that are skilled and knowledgeable in breastfeeding, we believe that this can help to improve and also limit some of the cultural challenges that may exist in different communities.
Thank you so much, Robin. So basically what it is that you're doing, you're not just keeping it within the health sector, but you're spanning across the different sectors to have an integrated approach. And that's very important when it comes down to, collaboration, and grassroots definitely have a part to play in that. Dr. Morris, I know you had mentioned the 10 steps to breastfeeding, but is there anything that incorporates these 10 steps? Just from a regional perspective, what exactly is being done to get rid or, quell some of these cultural norms and societal expectations?
All right, so I did mention before the education of mothers, and that is a part of the 10 steps, as I mentioned. But really, we have to be able to equip our health workers. So the health workers are who mothers are interacting with. They're the ones who they rely on for information. And sometimes they do come up against competition from the cultural norms, as you mentioned, and then from what mom says, what grandma says. And, their information might not really be correct. So mothers have to be equipped from the time, even before they get to the hospital. It's called the baby-friendly hospital, but there are aspects of it that need to be implemented in primary health care, for instance. So in antenatal care, when mothers are going to the clinic, from that time, they need to be helped and be counseled in terms of the information that they're getting, the why breastfeed and the how to breastfeed, all of that at the clinic level in preparation, but also with the community. And some people spoke about the community support, and that's very important. If you know the BFHI step 10 at discharge, that interaction with other mothers or with health workers so that there is support. So the support groups that were mentioned are very important. Sometimes we're getting very modern now. Sometimes it's a WhatsApp group that is formed and they can exchange information. But mothers need to be provided with contacts so that they can contact their health center, contact other mothers who are knowledgeable, and get the information that they need. So the support is what I would really stress is necessary. And we are planning at PAHO to have an online course for health workers primarily in order to help them to be able to support mothers.
Is Dr. Morris, thank you. Is this online course accessible by, is this something that they can just, what does that look like?
It is right. So it is based on the WHO UNICEF course for health workers, and it will be on the virtual campus for public health, and that's on the PAHO website. And so it is available to anyone, and it will not be at any cost.
Oh, nice.
Okay,
So we are
when it
definitely
is
educating
launched,
our healthcare worker. Oh, so it's not
right,
launched as yet.
not launched, but we incoming days.
Okay, awesome. Happy to hear. So we'll look forward to that update once that happens. And Dr. Bernard, I just want to find out a little thing, just want to hear from you. I know you talk about the same, all of us are having the same issues, right? But what are some things that you have been doing with regards to cultural and societal norms? How are we helping mothers to overcome that in the postpartum period?
So at the BCNF, certainly we try to get into areas where we know we will find pregnant mothers in particular. So we go to the antenatal clinic at our lone public hospital, the Queen Elizabeth Hospital. We go to antenatal and we go to postnatal clinics in the polyclinics as well and provide education information. There's a lot of, saw someone in the chat mention, there's a lot of misinformation that is bandied around it by the mothers, but they also mentioned the health professionals as well. So we actually have started to develop a program for providing information sharing and training for health professionals based and aligned with WHO and UNICEF guidance, of course. And then we have our own materials that we create ourselves and we distribute, all evidence-based. We create and we distribute to doctors' offices, so obstetricians and gynecologists, pediatricians. We also share them with the clinics at King Elizabeth Hospital, the polyclinics, so that the misinformation, we're misinformation, bandits. We're trying to get rid of a lot of the conversation that's out there that isn't true. Example would be one of the major issues that mothers have in Barbados, a big one, is that they feel that breastfeeding causes breast sagging. And so that is a deterrent for some mothers who want to breastfeed. So we try to get rid of a lot of that misinformation. The fact that breast milk isn't appropriate or useful after a certain period of time. So we try to get rid of that information by sharing our pamphlets and also getting into these spaces where pregnant mothers are.
Thank you so much, Dr. Bernard. And one of the things that I always say is that because there's an alternative, you can always just go into the supermarket or the pharmacy or wherever and pick up a can of formula. And because the alternative is so easy to access, it makes it that much more easy for a mom to give up. So we definitely have to do our part in combating the strengths of their marketing, even though they have the marketing budget that we don't. But, I think there's strength in numbers. And I think once we have a united voice, it will make things, I'm not even going to say easier. It will get things moving. That's the reason why we're having this conversation so that we can get the troops going ahead. All right. So, Renee, this question is for you. what are some practices that have been implemented in your country to improve breastfeeding outcomes? Can you let me know what do breastfeeding outcomes look like generally, and what are some practices that you have or have been implemented in the Cayman Islands to improve those outcomes?
You're putting me on the spot, Samika. All right, so we do have some ways to go. Back in the day, we did have a breastfeeding coordinator that helped us to collect our data and just ensure that those information was submitted to PAHO. We've since regressed, so to speak, and so we don't currently collect statistics at the moment, which is something that we've realized to be an issue because we want to be able to improve our practice and to see if what we're doing currently is making a difference and how we can improve or get further assistance in this initiative from organizations such as PAHO and UNICEF. So what has happened is that all of these have come to the fore, and we realize that it is an issue, and so it has led us to have discussions among ourselves, as well as we've talked about going up to the government level about what we can do to improve what is currently being offered. So we had in the past, we don't have. Based on what we have currently, we do see holes or areas for improvement. So what is offered currently is that we have a central location where prenatal breastfeeding education is provided. And we realize we're not capturing everyone. We have the private facilities and families can go there, but then we have the government facilities that would reach the other group of population. So we are looking at expanding our reach through virtual methods, as well as to increase to other district locations to catch more women to provide them with that breastfeeding education and support. Also, we realize that the need for data aggregation, we need to collect more data so that we can inform our practice. And most importantly, we need to have consistency in healthcare practices. So we need lactation education training for all our staff that interacts with these families. And most importantly, we need policies to support what we're doing.
Well, it's important that you realize what it is that you don't have, because if you don't know what you don't know, you can't do anything about it. So It's good that you know that you're lacking data and you can put measures in place to get that data. So thank you, Renee. Robin, let me just ask you, what are some practices that have been implemented to improve breastfeeding outcomes? I know you're talking about things being mobilized across different sectors, but is there anything specific? Can you name one of the campaigns, or is there anything specific that has been implemented to improve breastfeeding outcomes? So the initiation is one thing, the continuation is another thing, but sometimes we start and we stop because there's lack of support. So can you let me know about some of that you've been doing?
Okay, sorry. In Belize, two things have helped us a lot. Firstly, I would say we recently launched our new breastfeeding policy, which has been endorsed by government. So at the highest level, that has helped a lot to make people understand the importance of these campaigns and the importance of breastfeeding support. Secondly, we recently launched it in November last year, 2024. Secondly, we have started to have breastfeeding committees. So each of our clinics and hospitals have a committee with different members of the hospital being a part of the committee. So we're looking at chief of staff, community health workers, nurses, even different advocates. We're looking at health educators, nutritionists. So these committees are in charge of doing campaigns and breastfeeding support in different parts of the country. So then it is decentralized in a way where the campaigns and their creativity is encouraged. So because of that, we have more people on the ground supporting breastfeeding. So I think having the highest level show support and approval for this has trickled down to our hospital staff, our committees, and then also those persons engaged in campaigns, different types of campaigns, and the creativity is really across all sectors. They meet with fathers. There are many different activities that they do. And also, I mentioned before, we have scaled up looking at having certified lactation counselors in our hospitals and clinics. And I believe that has helped us to improve our breastfeeding outcomes for Belize.
That's awesome. I know you probably won't be able to give us the extent of it, but can you tell us a little bit about some of the things that the policy enforces, like just one or two things that you think are significant that has helped?
One of our main strategies in our policy is capacity building, and that goes across sectors. So we try to scale up capacity building and health promotion or breastfeeding promotion and support. And those go across sectors, education sector, the different health sectors, and also our public health sector. So that is in our policy, and I believe that that is one of the strategies that we work on a lot, and also having the capacity building to do trainings. We're doing a lot of trainings. We're training countrywide. We are training the staff in all the hospitals and clinics. It's a very extensive process, and I think all of our public hospitals, clinics are certified as baby friendly. And that is another aspect. Just to be recertified, they have to have massive trainings and intense trainings for everyone in those facilities. So the capacity building is really scaled up, and that has helped us a lot to have positive breastfeeding outcomes.
Looks like I need to come to Belize. Dr. Bernard, I know we had a little bit of a discussion, behind the scenes, but what do you think about what Belize is doing? Do you think that's something that you can
I was listening to what Belize is doing, and I thought I need to come to Belize, speak to Robin, and see how we can implement some of those activities. Absolutely.
You guys are welcome to come anytime.
I wanted to say, though that Barbados is doing a bit as well. We have our BFHI, but we obviously the issue with BFHI is constantly needing reaccreditation. On a consistent, I think it's every 2 to 3 years, Dr. Morrissey, correct me if I'm wrong. But every year we do things like having public awareness campaigns for World Breastfeeding Week. Breastfeeding Week is a big time for our public facing for breastfeeding. The other things that we kind of do are having a lot of strategic partnerships. For example, BCNF would have put their breastfeeding policy guidance in the National Workplace Wellness Policy. So, and I felt that meant that was a boon for breastfeeding in the workplace. It means that they were, Ministry of Labor, Social Security, and Third Sector was taking that seriously. And we are working with Ministry of Labor now to develop that policy for breastfeeding in the workplace. So we are doing things. We're forming strategic partnerships. It's moving slowly, but it's we're getting somewhere.
Dr. Bernard, don't be daunted. The best time to plant a tree was 10 years ago. If you don't plant the tree, it can't grow. All right.
Exactly.
So we're planting the seeds,
exactly,
and they're gonna get roots, and we're actually getting, we're joining forces now that we can share best practices. We're gonna share numbers. We're gonna visit countries. We're gonna do everything, and we're gonna all be happy breastfeeding. Yeah. So, so thank you so much for sharing, Dr. Bernard. Dr. Morris, so we're coming to a close with the question. So this one is definitely for you. As highlighted in the International Code of Marketing of Breast Milk Substitutes, and you did mention before with relation to the strength of the marketing of the formula companies, protecting children and mothers' rights from marketing interference falls under the state's commitment to the United Nations Conventions on the Rights of the Child. Within your area of expertise, what can be done or what is being done to combat the pervasive marketing strategies, such as branding, such as brand recognition, conditioning, employed by food companies?
All right, so I'd start by adding that it's not only the rights of the child, but there's actually been a statement issued by the rapporteurs on the right to food, the right to health, the Working Group on Discrimination Against Women in Law. So it's a lot of these different rights that this goes right across, it intersects with so many different rights. What needs to be done we have the International Code of Marketing of Breast Milk Substitutes. So that was approved by the World Health Assembly since 1981. And guess how many of our Caribbean countries have put that into law? I'd have to say almost zero. None of our countries, except for Trinidad, which has some small aspects in terms of labeling of formula in their laws. So if we have a code, and this is basically just a gentleman's agreement, without it being put into national law, nothing is going to be done. Apart from now, so the law has to be enacted nationally. How are you going to have sanctions if you don't have a law? So the law has to be put into force. And also once it is there, it needs to be monitored and enforced. So there are some countries which have put in place a law, but it was several years ago, and the law is just sitting there. Nobody's monitoring it. Nobody's enforcing it. So if you look at the graph, the two graphs on your screen, you see that the more of the provisions of the code that are put in place, you'll find that there is an increase in exclusive breastfeeding and that there is an increase in breastfeeding up to 2 years of age, sorry. So putting the law enforces one and monitoring and evaluate and enforcing it. So although the Caribbean really has not put these laws in place, other countries in our region have. Specifically, I can think of Panama and Brazil. They have had laws that have been enforced for some years. But as I mentioned, overall, there needs to be monitoring and enforcement. Also, even if a law is not put into place, countries can still monitor what is happening with the code. It is stronger if it is a law, but there are several countries which have a code watch, different organizations, such as their non-state agencies. They can be monitoring the code, looking for infractions that they hear on the radio, on the television. They see some promotion of breast milk substitutes going on. There should be a body to which that can be reported and some sanction put in place. But really, if there's one thing that I would encourage countries to do is to enact the code and also follow this by monitoring and enforcing it.
Thank you, Dr. Morris. So I know that we're doing pretty good with time, and we're actually going to go into the question and answer segment now. So I will hand over to Norja I think there are a couple questions in the chat. So we will just post. We're not going to be able to do all of them, guys, but let's see what we can get to the fore, and just prepare yourselves, please, panelists. And over to you, Narja.
Sorry, 1 second, my screen is frozen. We do have, hello, can you hear me? Yes, we do have one more question on our Mentimeter to poll just to see how the audience is feeling with all the information we just received. Great information at that. So I'm going to share this quickly and then we'll get right into our Q&A.
Norja, sorry, in the interest of time, perhaps we can just go straight to the Q&A.
Okay, that's fine as well. All right, so there's been some questions in the chat. I'm just gonna scroll and pick at random here. So this one is from Dr. Lexi Bryan. Are there in-services done at regular intervals so all who work within the OB and PEDS department can stay abreast with breastfeeding best practices to bolster the clinician's confidence while simultaneously empowering moms and families on their breastfeeding journey? I think this one would be more directed to Renee. I'll leave it.
That's a good question. Unfortunately, there isn't. However, we do have health professionals that have taken it upon themselves to do their own training. But from the facility standpoint, we don't have something in place. We don't have a mandated training. It is something that we're looking into, and that is also part of our discussion. But at this time, we're doing it individually. We have IBCLCs on the floor, whether they're actively advocating or not. We do have a few certified IBCLCs, and then we have lactation counselors, but everybody is just doing it on their own time.
Thank you for that, Renee. There's another part to this question that I think would be interesting to know. Is there data for how many lactation consultants there are across the region?
So for us here in Cayman, so we're a melting pot. We have individuals from right across the world. I think we have about 5 IBCLCs on island here. We have about maybe 3 within our hospital, and we have 2 private hospitals that have 1 each, and then another facility. But so here in Cayman Islands, we have about 5, and then we have lactation counselors themselves. But right across the Caribbean, I'm not sure how many is within the Caribbean itself.
I'm going to ask another question, but before I ask that, because it's from the same person, please, if you have a question, put it in the chat. Given time, just be very concise with your question, and we'll try to get those answered. So this question is also from Dr. Lexi Bryan. Is there a centralized messaging at the regional level that is consistently being disseminated to each country's Ministry of Health and individual hospitals? And this is for everyone.
Or let me try. Let me take a go at that. In terms of centralized messaging, so you have occasions such as this, World Breastfeeding Week. Countries may have a National Breastfeeding Week, which they have at the same time or at another time. So there's usually a theme at that time. So that theme is usually where you find your events and your messages centralized during the week. And you'll find at a time like this, there's usually like a call from UNICEF, and a call, meaning a call to action that is put out. Other than that, we at PAHO, we have a BFHI network of government representatives. So when we share information with them, when there's new information, for example, it is shared within this network, and then we expect that this type of information will be disseminated throughout the different countries. However, you will find that there is, of course, autonomy within countries. So they will choose what is their main issue at the time and what they need to focus on. But we do disseminate the information as we get it, and it is up to countries to really implement it as they like or send out the messages in their own countries.
Thank you, Dr. Morris. I wonder if there could be some, I don't know, regional pact to hold countries accountable outside of just the breastfeeding week, so that we can continue having momentum throughout the year for promoting breastfeeding. I think that's probably one direction we could go in to continue promoting breastfeeding. There is a question here by Cheryl Ann James that I'm going to ask. So lactation specific training is at minimum 45 hours. However, the BFHI training is 21 hours, but does not allow for practical assessment. Does it ensure there is a full understanding and ability to provide appropriate breastfeeding guidance?
So if I can take that again. All right, so the course is 21 hours, and it's up from 20 hours. We've always had a 20-hour course. The course itself, following the revision of the BFHI in 2018, that course was revised, and it's now 21 hours, which includes a practical component. I think there are at least 3 practical sessions within that course. However, what the course is one thing, completing the 21 hours is one thing, but what happens after? The health worker needs to be able to support mothers. So what WHO has recently also introduced is a competency assessment. So there's a competency assessment toolkit available that you can actually use the tools to assess your healthcare workers on, for example, different aspects of the 10 steps or different bodies of knowledge, different topics to see where they may need to make improvements, or you may find out that they are basically okay in one area, but they need to improve in another area. So there is a competency assessment toolkit that already exists and is being improved upon. We're expecting new information on this from WHO in coming days.
Well, we'll be looking forward to that, Dr. Morris. Yes, curious to, hopefully we can start getting some data to see how that toolkit impacts providers' ability to provide correct information to mothers and the breastfeeding rates, how that will look in the years to come. Another question from Tanya Ambrose. What can we do collaboratively on a regional level to ensure we can implement baby-friendly hospital initiatives and increase breastfeeding among birthing individuals? Lack of education is a major key. What can we do at the policy level? I'll try to direct this question to Dr. Bernard. And if you don't want to speak now, you can pass it to someone else. Sorry.
Yeah, I'll probably pass that on. I think Dr. Morris might be a good person to probably have an idea about that as well.
Just wanted to give other panelists chances.
Yeah, I realized. Dr. Morris, you wanted to take it? So you unmuted.
No, I just think the whole issue of policy is so important because and policy at different levels. So within the hospital, you can have a hospital policy so that everyone within the hospital is on the same page. You can have you need to have a national breastfeeding policy. Some people have a national infant and young child feeding policy that covers the whole area of breastfeeding up to 2 years of age, or some of them up to 5 years, or whatever it is. So policy is very important so that everyone is on the same page. And there are, what I would say, there's certainly information that we recommend within the policy, but there's no one regional policy at this time, except for, what we recommend on that the policies would be in line with the global strategy for infant and young child feeding. Okay.
I just wanted to just kind of add here. Maybe we need to start having conversations at a regional level around breastfeeding. I think, this is the start of it. Healthy Caribbean Coalition, a regional organization, putting on something like this, but then how can we extend it? Maybe a conference where we bring together all of us, and then other persons within the region who the policymakers, the change makers, actually have us all come together and start having discussions, including the academics, the researchers, and then, maybe we can start talking about policy. But I think until we actually have a combined, getting together and conversing about breastfeeding, I don't think that's going to happen. Regional policy is not going to happen until then.
I agree, and I think this is one of many conversations that can start that movement towards a regional movement with getting policy done across the Caribbean. And just to because we're almost at time, mentioned earlier, talked about data aggregation and how statistics on breastfeeding over the years is necessary. And in medicine, we talk a lot about evidence-based practices. And so in order for us to continue improving our breastfeeding rates, improving child maternal fetal health outcomes, we definitely need statistics to drive how we approach this. So I will turn back over to Samika to continue.
Thank you so much, Narja. I think I just wanted to highlight, I know that Robin did speak heavily on the policy being implemented in Belize, and they're definitely seeing the results of that. So policy definitely is one aspect of it, but enforcement is another. And if we don't have buy-in across the region, that's gonna be a tough cookie to crack. But in any event, I thank you, Dr. Morris, for sharing your perspective from the regional level. And Dr. Bernard, you seem to be on fire and ready for things to happen. Let's not make the water die, you know. We have to do something about it. So with that in mind, we had asked you guys to just, if there's one thing from everything that you said this evening, we just want you to give us a strong call to action. So we're gonna ask you to just share your call to action, and everybody that's in the chat, I know that you have so many things that you're interested in happening, but these are the things that we want to happen now. Everything can't happen at the same time, but if there's nothing else that you take from the webinar, each of our panelists are going to share their call to action and do what you can with it as best as you can. So Dr. Bernard, go ahead with your call to action.
Okay, so awareness of the issues is necessary, but let's move beyond awareness to action. Employers and policymakers create breastfeeding friendly workplaces and private spaces, flexible breaks and flexi time, and supportive breastfeeding workplace policies. It's not just good for mothers and their babies, it's smart for business and vital for national health.
So we definitely want to move away from just awareness. We want to move to action. So enough talk. We need to see the action going now, right? Renee, what's your call to action?
Thank you, Samika. Yeah, so we're in the baby stages in the Cayman Islands, and we do have a robust breastfeeding movement, but we lack crucial data. We have the feet on the ground, the community midwives, the community supporters for breastfeeding. We have lactation consultants, and they're all doing a great work. But we have a systemic challenge. We still have untrained staff, limited access to breastfeeding education for mothers in eastern parts of the island, and we don't have a national policy. We don't have not all facilities have a breastfeeding or infant feeding policy that guides them. And so, you know, those are some of the challenges we're having. Also, we have a clear approach, but we need to collect these data. We need to draft policies. We need to ensure breastfeeding education and support is readily available to everyone.
I see you're very strong on the data, Renee. Please let us know, as a matter of fact, let Dr. Morris know if there's anything that we can do to help you with relation to that data collection, because data is definitely key in allowing us to do, because if we don't know, as I said before, we don't know what we need to do about it. So let us know if there's anything we can do to assist in helping you to do better at data collection so that we can get things moving with the support.
Absolutely. I'll be in touch with you, Dr. Morris.
And Robin, what is your call to action? You spoke so beautifully, like I'm so jealous of what's happening in Belize right now. But with everything that you are experiencing, and I'm sure you're seeing the fruits of your labor and what has been implemented, but based on what we've discussed this evening at this webinar, do you have what is your call to action for us to take home?
Thank you very much. The call to action from my point is, firstly, I will say policy. Like I mentioned, that's a stepping stone, that's foundation. Just having that policy, communicating that policy, and making sure everybody's aware of it and the role that they play to implementation of that policy. So that is like foundation. And to do the policy, of course, we have data, we have our workers, our workforce on the ground as well. And the second call to action is collaboration. I need to mention that we would not be having our improvements and our positive outcomes if it's not for collaboration, and collaboration across sectors within different partnerships So with UNICEF has been very supportive with us. Also PAHO, in terms of the Ministry of Health and our local stakeholders as well. When we have our activities, we actually have a month that we celebrate breastfeeding. 1 week is not enough for us. So we do the entire month of August, and breastfeeding is our unloved campaign here in Belize. We go all out, and it's literally in the communities. Our community health workers, our health educators, our nutritionists, they collaborate, they come up with very good creative ideas. So the promotion is widely spread, and that ties into the collaboration that I mentioned. So those are 2 areas that I would stress for call to action. Having your policy, and of course, working along with people and working within sectors, that helps a lot to strengthen the support on the ground. And those would be my 2 recommendations.
Thank you so much, Robin. If nothing else, I'm sure you've sold Belize to all of us. All of us are going to start booking our tickets to come there right now so that we can see the best practices. And last but definitely not least, Dr. Morris, I know I kind of put you on the spot a lot tonight, but I'm sure with the hats that you wear, you're used to it. Let me hear your call to action. And in the chat, guys, if you have a call to action that you want to be mobilized, please feel free to put it in there. And Dr. Morris, please, your call to action.
Well, I'm going to turn it back around on community NGOs such as yourselves. It was really encouraging to see this Veranduh chat, as you call it, being hosted by the Healthy Caribbean Youth during this World Breastfeeding Week. So the call for action that I would have is for organizations such as yourself to continue your advocacy for policies, and that regional policy that you spoke about, we don't know, maybe, but for countries to have national policies in your countries where you are, for laws such as the code law that I spoke about that none of our Caribbean countries have implemented fully, workplace policies also, and maternity protection laws, so that mothers can breastfeed for the time that we are recommending that they breastfeed exclusively. So we want to hear more coming from you, and that is the call that I'm making, that this would be a constant effort on your part, organizations such as yourself, and in particular the youth, so that we can, we have another generation coming that will be protecting, promoting, and supporting breastfeeding.
Thank you for handing back the mantle, Dr. Morris. If I had one call to action to make, it's that the Healthy Caribbean Coalition has done so much when it comes on to ultra-processed foods. And I always say, and Daniel knows that I always say this, that formula is the first ultra-processed food. And I think if we can start from there and see how we can combat. I mean, we are small and I know they're big, but guess what? David slayed Goliath. And I think that we can do so much from where we are. And I think this is just the beginning of everything. And I think if we can start to put things together to get some grants and some support and some funding to fight them. I mean, big food is being fought, by Bite Back, and we have so many things going on. So I think we can start the fight. I think this has, started, ignited the fire. I know that Dr. Bernard is ready. Robin has the best practices, and Dr. Morris will push on us. And I think we can start. So I am going to hand over to Doriel and Neo for the final remarks.
Thank you, Samika. First of all, I'd like to thank all of our panelists and participants for helping us create this space for such an important conversation. And we really hope to continue this conversation. I think so many gems of information and knowledge were shared. I love that we emphasized, the importance of strong networks. Breastfeeding mothers and parents need strong networks and systems to rely on and to lean on. And that requires, as our panelists alluded to, collaboration across sectors, across communities, and importantly, making sure that we have this accurate and empowering information that reaches not only mothers and parents, but also healthcare professionals, everyone really. And I would say it's really heartening and encouraging to see all the work that's been done across the region. But I really want to echo Dr. Morris's remarks. We need to implement and enforce the International Code of marketing of breast milk substitutes, because that industry is $1 billion industry and we need to fight back. And I would like to pass it on to Neil now for our closing remarks.
Good night, everybody. I'm Neo Swan, and I just want to say once again, reiterate what Doriel said. Thank you so much to all our panelists that came out here tonight. And I do want to say thank you to the HYC members who also organized this, Danielle, Nuria, Samika, Jafan, Doriel, and myself. Like, it is important that we have these conversations. And also a big thank you to everyone who came out to listen to this Veranduh chat tonight and even popped your questions in the chat. As we said, it is a community effort. It's not solely on the mother to breastfeed. It's important for us as a region to have these groups, have these organizations that are there for the mothers to lean on. And also just looking at breastfeeding in the wider context, as Samika just mentioned, that is, breastfeeding, the formula is the first ultra-processed food. I love that point. I haven't heard someone put it across like that before. And we just want it reiterate, looking at it in the wider context and the Caribbean and how we struggle with our NCD burden, we do need to, have those discussions about increasing uptake of breast milk for infants, because at the end of the day, the science has shown us that breast milk has played, protective factors in the development of NCDs in adulthood later on. Looking at those long-term effects is not just a baby and a mommy problem, it's a problem for the entire Caribbean, and we have to fight it and focus on how we can implement those changes and support those mothers. So just want to say once again, thank you to everybody who has come out tonight. We do really appreciate it. And I've enjoyed this chat myself. I know I'm not the only one. I see everybody engaging in the chat. It's been great. The presentations have been great. So what we've heard tonight has been great. So once again, thank you everybody for coming out tonight. Thank you to the HYC members. Thank you to the panelists. And we hope that you all have a very good night and that we take everything that we've learned here tonight, everything that we've discussed, that we take it back to our respective countries to get a stronger Caribbean, a healthier Caribbean at the end of the day. Thank you.
Guys, before you go, we like to take a picture. So if your camera ready or not, can you just pop on your camera so that we can just take a picture? Because we like to record these moments. Daniel, you can count us off.
Okay, great. Great. The cameras are coming on. Again, a huge thank you to all of you for coming out and for all of your warmth and support that you were sharing in the chat. Again, we had great representation from across CARICOM, so appreciate all of you. Good. Great seeing the cameras popping on. Okay, I will go ahead now. I'm going to have to do 3 pictures, so bear with me. All right, a couple more popping on. Great. So if we could do 3, 2, 1. Are we ready? Smile. Great. Hold on. 3, 2, 1. And one more. 3, 2, 1. Excellent. Thank you all so much. Have a great night. We look forward to reconnecting again. We will share the recording from today's session as well as a one-pager with some key takeaways. So we're looking forward to continuing the conversation. Thanks, everyone.
Bye, everyone.
Take care.
Thanks for coming.
Huge thanks again to our panelists and our planning team.
Have a good night, everyone. Thank you.
Have a great night.
It was
Good
great.
night.
Bye. Good night.